We are certainly on the same street, so I'm glad to be that you started off, because it's very similar themes. So I'm so happy to be here, and we're going to try to keep you awake after lunch. I'm here because I developed with colleagues the Capable program, and what that does is unleash people's own goals, what they want, to try to help them age in place in their home. And it's 16 weeks of a nurse, an occupational therapist, and a handyman. I've been a house call nurse practitioner for a long time, and was so impressed with how much people's home environment was as disabling to them as their medical conditions. You know, people who answered the door on their hands and knees, or people who had to drop the keys out the window because they couldn't get downstairs to greet me. Or someone who had a 100-year-old who had to get on her knees to get into the kitchen because her wheelchair didn't fit through, and so all she could do would be to grab some food from whatever she could reach on her knees. And so together with colleagues, developed this Capable intervention. And keep in mind that 50% of hospitalizations for older adults are preventable. No one's trying to prevent the ones where someone really needs a hospitalization or healthcare costs because they have cancer or something. But that other 50%, no one's having fun. And no one's saying, oh, I'm so glad I went to the hospital. And so Capable is trying to get at those hospitalizations and nursing home admissions. So we were attested with a CMMI Innovation Center grant, and also we're on our second randomized controlled trial. Capable costs less than $3,000. How do I advance? I don't, okay.
Is there the large green button at the top?
Sorry. Okay, thanks. And I'll tell you about how it's person-directed. We seem to have a 7 to 10 times return on investment if you count Medicare and Medicaid within 2 years after. And I'll just tell you a little bit about how that works. But first, I'll just say that Capable is now in 27 places in 12 states. And that's through a range of payers and providers and provider types. It's recently been just approved by CMS to be in the Medicaid waiver in Massachusetts for people who are nursing home eligible, but trying to stay at home to thrive in the community. And this is the real reason that I'm here, is that the person and the environment have to fit together. So not talking about homelessness, I'm talking about older adults who are housed. That if people cannot reach into the cabinets, if they don't have closets that work, if they've got holes in their floor, if they've got banisters that are shaky, right? So some of that is repair, some of that is modification. There's modification all over the country in small programs, but there's almost no one who pays for repair or for everyday items like a sturdy step stool. And so to give you an example, a very common example is someone is lonely, and it's partly because they can't get out of their home, and that's partly because they have a hard time getting dressed, and they have a hard time getting down their front steps and into someone's car. So with the occupational therapist, they may make a goal. I want to be able to get dressed. I want to be able to get down my steps and into my daughter's car to go somewhere. Then that home modification budget isn't just for the home, it's also for, so it would be for the banister, it would be for a zipper helper and a sock aid, for example. It would also be for a portable car hook and a swivel seat for getting into the car. Those two, all of those things together would cost less than $100. But they are the difference between someone being able to go participate in the community and not. And so we don't go in and we say, here's your sock aid, or here's your banister. We say, what would you like to be able to do? To be able to age here, it have healthy days, as the gentleman from Humana said. What would you like to be able to do? And they say what they would be like to be able to do, and then we work with them about let's think of ways to do that. So they may think of, I would like to put some chairs around my home so that I can practice getting up and being able to walk farther so I don't have to go on my knees. And it's their own motivation and their own strengths that dictate what the nurse and the occupational therapist and the handyman work on. And so it builds self-efficacy for new challenges as well. We have people who call us months after they finish the program and say, I have a new goal that I'm brainstorming and I want to tell you about it. And so older adults, we sometimes in health policy think about as, oh, well, they're going to cost a lot, or, oh, they're near the end. But really, there's so much preventable harm to older adults. And I'm happy to be part of this conversation.